When Dr. Kanda found in 2013 that we're seeing gadolinium in the patient's brains, a few things were startling there. And the number one thing of all that people may not have recognized, but what was the most concerning, is that this is even in patients with normal kidneys. It's an extremely small amount, but you did not need poorly functioning kidneys to see gadolinium in the brain. If they got enough of it, it would show up. So this is even with patients with normal renal function. That's one concern. Number two, it seemed initially that it wasn't happening with macrocyclics, it only happened with linears. That doesn't seem to be true either. What we're finding is that every agent leaves some. But again, as we started on that discussion before, macrocyclic agents tended to leave less, although there are differences amongst the macrocyclics, it seems. The linear agents tend to leave more, but there are substantial differences amongst the linear agents in how much they leave. Beyond that, what is it that you're leaving? What are you leaving? For example, I injected into my patient gadolinium ligand as a chelated complex. Remember. So what are we detecting in the brains of these patients? 2-3 years ago, I would say to you, we don't know. But now we've been able to find that there are 3 forms of gadolinium, at least, that are being left in humans in their brain and potentially other parts of the body. One form is exactly as you had initially intravenously administered it, meaning it's the gadolinium ion together with its ligand molecule, just exactly how you took it out of the bottle and injected it to the patient. That same complex, it's right there. Can you see it? It's right there. That's one possible form. Macrocyclics that leave very little, that's the form that seems to be associated with them. The form as initially administered.
That's how tight that bond is, right?
The bond is that tight that it seems to still be intact years later. Linear agents have one of 3 identified forms so far. The first is the same as we just discussed, which is exactly as administered. That same gadolinium with its ligand molecule intact sitting in the brain. That's one of the 3 forms. Another form is a water-insoluble form. What does that mean? In order for it to be water-insoluble, it's not interacting with water. Well, I certainly did not inject in any of my patients any water-insoluble gadolinium. Look at it. It looks like water, right? Right. So in order for it to have been water-insoluble in this patient right now, it had to dissociate and reform with a new complex. That doesn't seem to happen with the macrocyclics. It seems to happen only with the linears. A water-insoluble form is type number 2. Type number 3 is that the gadolinium is somehow associating with some macromolecule, a massive molecule like a protein, albumin, something massive. That doesn't seem to happen with macrocyclics either. That seems to happen only with the linear agents. So let's go through this again. Both the linear agents and the macrocyclics are found in the form initially injected at extremely small amounts in the brain. Linears are also found in a water-insoluble form, and they're also found in a form that seems to be associated with some as of yet unidentified macromolecules. Now, why am I saying this? Well, the water-insoluble form, stay with me here, is water-insoluble. Meaning it doesn't mix with water.
Right.
And if it doesn't mix with water, that means the water is not going to be interacting with the gadolinium. So it won't have its T1 shortened. So the relaxivity, meaning the ability to shorten T1, the relaxivity of the water-insoluble form is almost certainly extremely poor.
Right.
And therefore can't be accounting for what they saw on the images in MRI where they're seeing T1 shortening.
Wow.
The macromolecular association, that would be a powerful T1 shortening. So that may be the form that may be accounting for why we're seeing T1 shortening more with the linear agents than with the macromolecules. Right. Now that we got those out of the way, I have a question to ask you too. I can't talk with you without testing you, right? So here's the question. I have this syringe, and it's going to have gadolinium in it, and it's going to be in one of 3 forms. It's going to be in the form of the initial drug with its ligand molecule. Or it will be dissociated and it will be attached to something that now makes it a water-insoluble form. Or it'll be gadolinium associated with some macromolecule, let's say albumin. I have it in this syringe. I'm going to take this syringe and stab you in the head with it. And I'm going to inject one of those three forms in your personal cerebrospinal fluid. Right into the ventricle.
I'll take an A.
Which one do you want? In other words, think of the question for a moment. If you had to have in your cerebrospinal fluid, someone was going to inject one of those three forms, which form would you want injected? Do you hear the question?
Right. Definitely in this one, I would say the A, like the macrophilic, the way that one initially.
In other words, the initially administered form,
yep.
That the molecule, the gadolinium with its ligand molecule still intact. If I had to have it in me, I want it still together. Okay, that's what everybody answers. And there's no right or wrong.
Okay.
But I want you to understand. And Dr. Vogler wrote an article in 1995.
Right.
1995.
Dang.
Where they injected rats with all three macrocyclics and with Magnavist and with Omniscan. The neurotoxicity, which is the one that killed the rats the most? The macrocyclics.
Oh.
By far.
Trying to think why that may be.
Why it isn't as concerning as that it is. And that almost nobody knows about that.
Right.
So I'm just saying that I'm bringing out a point. We have to recognize, this is the key, the relative safety of as initially administered, together intact with its ligand molecule, versus, put that down, versus a completely water-insoluble form, versus associating with a macromolecule. We don't have a clue. You understand? Not a clue. Are any of them unsafe? And if they are, is anyone more or less? We have no idea. I can tell you that direct neurotoxicity of the macrocyclics, we've known since 1995 it's worse than the linears, Magnavist and Omniscan by Dr. Vogler and his paper and his co-workers.